name is Lianne and I'm a researcher at the University of Manchester. I work on the Biologics for Children with Rheumatic Diseases study, BCRD. Now BCRD was set up in 2010 and its aim is to look at children and young people with juvenile idiopathic arthritis, JIA, who are starting a biologic treatment such as adalimumab or infliximab, and to look at how these patients respond to the drug. We do not include patients who are starting etanercept, as these are enrolled on a separate study which is called the BCRD cohort study. And if you want to know more about what a biologic therapy is, then please see the video on our YouTube channel by our Chief Investigator, Dr. Kim Heinrich. Today I'm just going to speak to you about some of the patients that we've recruited into BCRD. This poster I presented at the Annual Rheumatology Research Conference earlier this year. And whilst there's a lot of information on it, if I just talk you through some of the key findings. So up until early April 2014, 280 patients had been recruited starting a biologic treatment. Over half of these were girls, as is usually the trend with JIA, and the age of starting a first biologic tended to be around the age of 9 years old. Now JIA can be split into subtypes depending on certain symptoms. Many of the patients in BCRD are systemic JIA or rheumatoid factor negative polyarticular JIA. 70% were also on methotrexate as well as their biologic therapy, and 35% had a history of uveitis, which is inflammation of the eye. Now many of the patients were starting either adalimumab, infliximab or tocilizumab, and almost half of the patients were starting a biologic for the very first time. However, some patients had already used a biologic and 74% had used etanercept. When we look at all these patients that have previously used a biologic, most of them were being registered starting their second. However, 20% were starting their third, and 14 patients were starting their fourth, their fifth or their sixth biologic. So as you can see, many patients in the UK are now starting a biologic therapy. If we can continue to follow these patients as they continue with their treatment, we can answer certain questions, such as how many go into remission, and also answer any questions of safety. If you have any questions about the BCRD study, then please get in touch with us.